This week 2025 will be celebrated from October 4 to October 10 with the theme Living in Space. World Space Week is an annual event that celebrates humanity's achievements in space science and technology. It is recognized globally and coordinated by the United Nations with activities taking place in over 95 countries. The week commemorates two significant events in space history: the launch of the first human-made satellite Sputnik 1 on October 4, 1957, and the signing of the Outer Space Treaty on October 10, 1967. The theme for 2025 is the theme for World Space Week 2025 is Living in Space. That means we are living in a space, or we have to live in a space, or we should live in a space, which emphasizes sustainable practices in space exploration and habitation. This theme encourages discussions and activities related to how humans can live and work in space environments. The activities and events of this Space Week, World Space Week, is during World Space Week, various events are organized worldwide, including number one, educational workshops. Schools and organizations host workshops to educate the public about space science and technology. Number two, stargazing events. Many astronomical societies and institutions conduct stargazing sessions, allowing participants to observe celestial bodies through telescopes. Number three, online lectures. Experts share insights on space exploration, sustainability, and the future of living in space through webinars and online discussions. There is also participation about this week. Individuals and organizations are encouraged to participate in World Space Week by hosting their own events, attending local activities, or engaging in online discussions. This is a great opportunity to learn more about space and its significance to humanity's future. For more information and to find events near us, we can visit the official World Space Week website. And this website is gonna give us many more informations about the World Space Week, which is going to be held from 4 October to 10 October 2025. This is going to be the World Space Week. On this day, World Space Week, celebrated annually from 4 to 10 October, commemorates the launch of Sputnik 1 in 1957 and the signing of the Outer Space Treaty in 1967. This global celebration of space science and technology brings together scientists, engineers, and researchers worldwide to showcase achievements in space exploration and inspire future generations. This year's theme takes us on an interstellar adventure to reflect on the challenges and opportunities of human life beyond Earth. Earth, the place where we live permanently. From ambitious extraterrestrial missions and the discovery of potentially habitable planets to advance in life systems and extraterrestrial settlements, the focus is on exploring how humanity might one day thrive beyond our home planet. MDPI journals serve as key platforms for scientific dialogue and collaboration through a compendium of articles, special issues, and webinars. We invite you all to engage with the latest research shaping the future of space explorations, covering themes such as living beyond Earth, building the infrastructure of space, navigating the challenges of space environments, and searching for life in the universe. These contributions broaden our understanding of space and its possibilities. Together, through research, innovation, and collaboration, we can build a future where space exploration not only extends scientific frontiers but also inspires generations to dream, discover, and to define humanity's place in the cosmos. Shohag Mansoor. Hello, friend, my country in Bangladesh, Shohag Mansoor. Hello, Shohag Mansoor, how are you? Which country are you talking from? Uh, Today is October, 4 October, and from 4 October to 10 October, these 7 days is called the World Space Day. Please support me, of course. Shohag Mansoor is a YouTuber. Ben's Life. Hello, Bombo class. Hello. How are you? And what's up? We are talking about World Space Day, World Space Week, and now we are going to talk about uh, why do we celebrate, and why do some questions. Now I am going to ask you some questions. Shohag Mansoor, hello, Bombo class, Ben's Life. Where are you from listening to this live? Bombar Clat. Okay, Ben's Life, Bombar Clat. Ben's Life is a very good person. He has been joining with us. Now, Shohag Mansoor, okay. We are going to ask you some questions, and these questions are very vital for us, for the Bangladeshi people, not only for the Bangladeshi people, but also for the people of the universe. Who should know how to answer these questions. Why can't I stop stealing? Number one question. Why can't I stop stealing? Number two, what treatments are available if I start stealing, and if I can't stop stealing, is there any treatment available for me? Number three, what treatments are most likely to work for me? Number four, how quickly might I stop stealing? Number five, how quickly might I stop stealing? Number six, will I still feel the urge to steal? Shohag Mansoor, I love you, friend. Okay. Ben's Life 67. Okay. Number seven, how often do I need therapy sessions and for how long? Number eight, are there medicines that can help? Number nine, what are the possible side effects of these medicines? Number 10 question is, I have these other health problems. Shohag Mansoor, so sweet. I have these other health problems. How can I best manage these conditions together? Number 13 question, how can my family best support my treatment? Ben's Life has given us a lot of pictures, lot of prizes through emojis. And number 14, Ben's Life. Okay, read this, please. Okay, I am reading this. He has given us very nice and excellent prizes through emojis. Are there any brochures or other printed material that I can have? What websites do you recommend? So these are the questions we are going to talk about, and the simple answer is it's called kleptomania. Kleptomania. Tung Tang Sahur, Ben's life. Tung Tang Sahur. What's the meaning of Tung Tang Sahur? Your friend, your country. Yes, Shohag Mansoor is from Bangladesh and our country. Kleptomania. Kleptomania is a disease, is a psychiatric disease, or it's a psychiatric disorder. Kleptomania is diagnosed based on your symptoms. When you decide to seek treatment for symptoms of possible kleptomania, you may have both a physical exam and psychological evaluation. Shoag Mansoor, I say this TG combo. TZ combo. What is TZ combo? Ben's life. Hello, hello. Which country? Ben's life. Which country are you watching the live from? The physical exam can determine if there are any medical causes triggering or causing your symptoms. Because kleptomania is a type of impulse control disorder. Impulse means convocat. Impulse means sudden, abrupt, aggressive emotion is impulse. Because kleptomania is a type of impulse control disorder, to help pinpoint a diagnosis, your mental health provider may ask questions about your impulses and how they make you feel. Review a list of situations to ask if these situations trigger kleptomania episodes. Discuss problems you have had because of this behavior. Have you fill out questionnaires or self-assessments. Ben's life, you are always talking about hi, but what is your question? Uh, Use the guidelines in the DSM-5, that is called Diagnostic and Statistical Manual of Mental Disorders, published by the American Psychiatric Association, or APA. Now let's talk about the treatment of sorry. The treatment for kleptomania is although fear, humiliation, or embarrassment may make it harder for you to seek treatment for kleptomania, it's important to get help. Kleptomania is difficult to overcome on your own. Without treatment, kleptomania will likely be an ongoing, long term condition which causes discomfort in your normal life. Treatment for kleptomania typically involves medicines and psychotherapy, or both medicine and psychotherapy, sometimes along with self help groups. However, there's no standard kleptomania treatment, and researchers are still trying to understand what may work best. You may have to try several types of treatment to find what works well for you. Medicines of kleptomania. There's little scientific research about using psychiatric medicines to treat kleptomania, and there is no FDA, Food and Drug Administration, approved medicine for kleptomania. However, certain medicines may help depending on your situation and whether you have other mental health disorders such as depression or substance misuse. Your provider may consider prescribing an addiction treatment medicine called naltrexone, which may reduce the urges and pleasure associated with stealing. Number two, an antidepressant, specifically a selective serotonin reuptake inhibitor, that is in brief called SSRI. Number three, other medicines or a combinations of medicines. If medicine is prescribed, ask your healthcare provider or pharmacist about potential side effects or possible interactions with any other medicines. Psychotherapy is also a form of treatment for kleptomania. A form of psychotherapy called cognitive behavioral therapy or CBT helps you identify unhealthy, negative beliefs and behaviors and replace them with healthy ones that can be used in different situations when needed. Cognitive behavioral therapy may include these skill building techniques to help you control kleptomania as number one, systematic desensitization and counter conditioning, in which you practice relaxation techniques and other strategies while in triggering situations to learn how to reduce your urges in a healthy way. Russell Khan has joined us. I am watching your video from California, America. Okay, very good. Thank you. I need some viewers from the United States of America. And how is Donald Trump? Okay, Russell Khan, I hope, please give us the answer. How is Donald Trump and how are the people of Bangladesh doing in United States of America, California, Hotel California? Russell Khan, have you listened ever to the song Hotel California? What a lovely ships, what a lovely place, Hotel California. Okay. Number two, covert sensitization, in which you picture yourself stealing and then facing negative consequences, such as being caught. If you steal, you will be caught. Aversion therapy, in which you practice mildly painful techniques such as holding your breath until you become uncomfortable, like when you get an urge to steal. Avoiding relapses. It's not unusual to have relapses of kleptomania. Relapses of kleptomania means you stop stealing and this habit again is formed. This is Hotel California. আপনি কি এখান থেকে? No, I don't live in Hotel California. I stay in Bangladesh. You watching from Hotel California. To help avoid relapses so that stealing does not go back to you, be sure to follow your treatment plan. If you feel urges to steal, contact your mental health care provider or reach out to a trusted person or support group. There are some coping technique and support techniques that we should follow when we feel the urge to steal something. You can take steps to care for yourself with healthy coping skills while getting professional treatment. Do you always speak English live? Your English is very, very good. Sometimes I speak live I speak English on live sessions, and most of the time I speak Bangla. Coping techniques and support system is very, very important for stopping kleptomania or stealing tendency. You can take these steps to care for yourself with healthy coping skills while getting professional treatment. Number one, follow your treatment plan. Take medicines as directed and attend scheduled therapy sessions. Remember, it's hard and you may have occasional setbacks. Number two, educate yourself. Learn about kleptomania so that you can better understand risk factors, treatments, and triggering events. OMG, brother, your English like book acho with Mamada WTS Madam at the 4 OMG. Oh my God, brother, your English like book. So okay. Where are you watching the live from? We WTS MDAA. Okay. Identify your triggers. Identify the situations, identify the thoughts and feelings that may trigger urges to steal so you can take steps to manage them. Number four, get treatment for substance misuse or other mental health problems. Your substance use, uh, depression, anxiety, and stress can lead to a cycle of emotional pain and unhealthy behavior. I'm from UK. UK, very good. UK. The sun never sets in the kingdom of the UK. UK was such a great country in the world, the colonial master in the world. Okay, number six, find healthy outlets. What is healthy outlets? Explore healthy ways to rechannel your urges to steal or shoplift through exercise and recreational activities. Number nine, learn relaxation and stress management. Where are you from? I am from one of the colonists you did make when you were the superpower in the world. Try stress reduction techniques such as medication, yoga, or tai chi, something like this. Stay focused on your goal. Recovery from kleptomania can take time. Stay motivated and by keeping your recovery goals in mind. Remind yourself that you can work to repair damaged. Your country name is a country from SAARC countries. I mean, there are 8 countries in SAARC, South Asian Cooperation Organization. SAARC, the name starts with B. It may become Bhutan, it may be Bangladesh. Remind yourself that you can work to repair damaged relationships and financial and legal problems. Be honest with loved ones. You might initially need help with controlling your urges when in higher risk situations, such as shopping. Let your loved ones know about struggles and consider using the buddy system for a period of time while you are learning more ways to manage your urges. Support for loved ones. If your close friend or family member is being treated for kleptomania, make sure you understand the details of the treatment plan, and actively supports its success. It may be helpful to attend one or more therapy sessions with your friend, your relative, to learn the factors that seem to trigger the urge to steal and the most effective ways to cope. You also may benefit from talking with a therapist yourself. Recovering from an impulse control disorder is a challenging long term undertaking, both for the person with the house disorder and close friends and family. Make sure you are taking care of your own needs with the stress reduction outlets that work best for you, such as exercise, medication, or time with friends. Self help groups. People with kleptomania may benefit from participating in self goal groups based on 12-step programs and those designed for addiction problems. Even if you can't find a group specifically for kleptomania, you may benefit from attending Alcoholics Anonymous or other addiction meetings. Such groups don't suit everyone's taste, but so ask your mental health care provider about alternatives. Preparing for your appointment, how to take preparation when you are going to consult with a psychiatrist. If you struggle with an irresistible urge to steal, talk to your healthcare provider. Be honest with the provider about your symptoms. Having that discussion can be scary, but trust that your provider is interested in caring for your health, not in judging you. You may be referred to a mental health provider such as psychiatrist or a psychologist with experience diagnosing and treating kleptomania. You may want to take a trusted family member or friend along to help remember the details. Also, So, someone who has known you for a long time may be able to ask questions or share information with the mental health provider that you don't remember to bring up. Here's some information to help you get ready and know what to expect from your provider. What you can do to prepare for your appointment: just make a list of number one, any symptoms you are experiencing and for how long. Number two, key personal information, including traumatic events in your past life and any current or major stressors. Number three, your medical information, including your physical and mental health conditions. Number four, all medicines you are taking, including any vitamins, herbs, or other supplements and the doses. Number five, all medicines you are taking, including any vitamins, herbs, or other supplements and the doses. Your medical information, including other physical or mental health problems. Ask questions to ask your provider so that you can make the most of your appointment. Some questions to ask may include: number one, why can't I stop stealing? Number two, what treatments are available? Number three, Number three, what treatments are most likely to work for me? Number five, how quickly might I stop stealing? Number five, will I still feel the urge to steal? Number six, how often do I need therapy sessions and for how long? Number seven, are there medicines that can help? Number eight, what are the possible side effects of these medicines? Number nine, I have these other health problems, health conditions. How can I best manage these conditions together? Number 10, how can my family best support my treatment? Number 11, are there any brochures or other printed material that I can have? What websites do you recommend to stay away from kleptomania? Now, what to expect from your mental health professional to better understand your symptoms and how they are affecting your life. Your mental health provider may ask you: question one, at what age did you first experience an irresistible urge to steal? Number two, how often do you experience the urge to steal? Number three, have you ever been caught or arrested for stealing? Number four, how do you describe your feelings before, during, and after you steal something? Number five, what kinds of items do you steal? Are they things you need really? Number six, uh, in what kinds of situations are you likely to steal? Number seven, what do you do with the items you steal? Number eight, does anything in particular seem to trigger your urge to steal? Number nine, how is your urge to steal affecting your life, including school, work, and personal relationships? Number 10, do you use alcohol or recreational drugs? If so, what do you use and how often? Number 11, have you been treated for any other mental health problems, such as anxiety or depression? If yes, what treatments were most effective? Number 12, are you currently being treated for any medical conditions? You may be asked more questions based on your responses, symptoms, and needs. Preparing for questions will help you make the most of your appointment. Okay, now let's have uh, uh, An overview or an introduction in brief about kleptomania or kleptomania. Kleptomania is a mental health disorder that involves repeatedly being unable to resist urges to steal items that you generally don't really need. Often the items stolen have little value and you could afford to buy them. Kleptomania is rare but can be a serious condition. It can cause much emotional pain to you and your loved ones and even legal problems if not treated. Kleptomania is a type of impulse control disorder, a disorder that involves problems with emotional or behavioral self control. If you have an impulse control disorder, you have difficulty resisting the temptation or powerful urge to perform an act that's excessive or harmful